Welcome to the musculoskeletal video series. In each video, we will demonstrate a complete joint-specific physical examination. These examinations would be appropriate for a patient with a specific musculoskeletal complaint. Today I'm going to show you the cervical spine examination. I'm Dr. Newcomer, a physiatrist at the Mayo Clinic, and this is my model mat. So the first thing we'll do is inspect. And it's very important to look at the alignment of the cervical spine. Patient should have a cervical lordosis, meaning that there's a curve anteriorly. I also want to look at the shoulders and see if there's any asymmetry of that or whether he has protracted shoulders, which can be common with neck problems. You also want to inspect from behind, and then I'll begin palpation. Palpating the spine. The first spinous process that you can feel is C2. It's just below the occiput. And I usually hold his head to give me a little bit of that so that I can press a little bit harder. And then I will palpate down the spine and I can actually feel the individual spinous processes. The C7 spinous process is the most prominent spinous process. T1 is often very similar. The way you can tell the difference is you can have him flex his head forward and flex his head up and down. Go ahead and flex. And the C7 actually moves, whereas the T1 stays stable. And then I'll go to the muscles, and paraspinal muscles are just right next to the cervical spine. And I'll palpate those on either side to see if those are tender. And then I'll go to the upper trapezius. Muscle pain is very common with neck pain, with the trapezius being the most common area of tenderness. So you really want to make sure that you palpate that and see if that's tender and feel if there are any tightness or any taut bands within the upper trapezius on both sides. For range of motion of the cervical spine, I usually do this actively. And what I'll do, Matt, is I'll have you bring your head down. And you should get his chin almost to his chest with that. And then come on back up. And then rotation should be about 80 degrees each direction. Yep, and then the other way. And you want to ask him if he has pain with that too, and if so, where is the pain located? Extension, go ahead and just look up. And he should bring his let's have you turn this way. And go ahead and do that. And he should be about a few centimeters from the occiput to his back with that. Go ahead and come back to neutral. Spurling's test is a test for cervical radiculopathy. And what we're doing is we are impinging the neural foramen and pinching the nerve. A positive test is pain down the arm. If someone has neck pain with this, it's not considered a positive Spurling's. I will also say that a lot of times I'm unable to even do this test because a patient is limited by their neck pain. The way you do it is you extend the neck, you bend them to the side, and you rotate them to the side, and then you push down on their head, and you hold it there for about 15 seconds. And again, a positive test is a reproduction of the pain down their arm with that test. Thank you for watching the cervical spine physical examination video.